Good morning, good afternoon, good evening from whichever part of the world you are. A very warm welcome to Empowered You, Kala Natrajan ke Saath. Before I begin, I would love to thank all the viewers, our audience who have taken out their special time and joined this interview. 10 Live News is a beautiful platform to know the stories and insights from different people from different walks of life. Today, we have a very special guest who will talk on health issues. But before I introduce him, I would like to introduce myself to you. My name is Kala Natrajan, and I'm author and co-author of 17 books. I'm a motivational speaker and founder of the program called Empowered You. Through my program, I help people build confidence and strength and help them love themselves, increase their self-worth, and become so sturdy and strong that they are able to face all their challenges in life head on. So today we have with us none other than Dr. Arvind Kate. Dr. Arvind Kate is an MD in respiratory medicine from Mumbai University, fellow of American College of Chest Physicians, associate fellow Royal College of Physicians London, basic foundation. He has a basic foundation diploma in yoga too, and from Mumbai University that too. And he's a consultant chest physician in one of the best hospitals in Chembur, Mumbai, Zen Multispeciality Hospital. So, Dr. Arvind Kate, a very warm welcome to you. Welcome to this program. And would you like to introduce yourself and say something to our viewers?
First of all, thank you, Kalaji, for inviting me for this program. And you have already introduced me, so I think no other introductions. I think we can start our program. You have already introduced me.
Yeah, doctor. So, doctor, we would like to know what inspired you to pursue studies in respiratory medicine. Were you liking these subjects right from the beginning? Many people have
Uh,
respiratory problems and they are not able to overcome that.
no, it was not decided from the beginning. Like I will be a lung specialist or a respiratory physician. After if I finish my graduation, that is MBBS, we have to give our entrance exam,
Doctor,
and through that,
your voice is slightly less.
can you hear me now?
Yeah, now
Is
it's
it clear?
proper. Yeah,
Your voice is not clear.
not clear.
Kalaji, I can't hear you.
Oh, Sunita, you can help because I'm talking loudly.
Kalaji, your voice is not clear.
Sunita,
Ma'am, please kindly log out our studio and rejoin.
Can you hear me, Kalaji?
yeah, I can hear you.
Yes,
Can
sir.
you
Loud
hear
and
me?
clear,
I
sir.
can't.
Your
I
voice is
can't
no
hear.
problem.
Your voice is not there.
Sunita, doctor says my voice is not clear, but I'm speaking loudly.
Yes, ma'am. Your voice is break, you know.
Anything.
Voice is not clear, Sunita.
Please kindly you are log out our
No
studio
voice
and
at all
rejoin,
from your
please.
side.
Oh my God. Okay.
Have you muted your mic?
Dr. Arvind ji, please tell us on your, work experience and all you as for basic information to audience for your education and everything.
Yeah, doctor, you can go on. Sunita,
Have you
what?
muted your mic? Can you just check with your setting? No.
I'm not done anything. I'm not muted.
Sir, right now Kalachi's voice is very loudly, no problem, sir. So please device volume full कर दीजिए so please kindly on your Dr. Arvind ji. I think sir sites problem ma'am.
Doctor, now can you hear? Doctor, can you increase your volume in the mobile?
There is.
Sorry for the inconvenience. Just a minute, please. Sometimes technical glitches happen. Just a minute. Sorry for the inconvenience.
Your Kalaji, your voice, your mic is on mute mode. Can you hear me now?
Yeah, I could always hear you. I can hear you.
Now I can hear you.
Yeah.
It is clear. Okay. So
Sorry for
coming
the
to the part.
inconvenience, viewers. Please listen to
No,
Dr. Kate.
sorry for this technical trouble, but now I think we can hear each other. So coming to the respiratory medicine part, see, it was not by choice, but I got into pulmonary medicine at Nair Hospital. But when we enter our postgraduate curriculum, then we start developing the respiratory medicine. Coming to why I become doctor, see, we used to see doctors. They are well reputed. They get good reputation in the community. I'd seen when I was in 8th standard anatomy hall of KM Hospital. I've seen those medical students with their white apron. So somewhere that got clicked that okay, I would like to become a doctor. This is as per as the story, and as you go into the profession, you start liking that profession.
Yeah, yeah. Doctor, going forward, what are the causes of lung related diseases?
See, lung-related diseases we can divide as acute diseases like which happen within 2 to 3 weeks period time, or there are diseases which are chronic, which last for more than 2 to 3 weeks, and they give trouble to our patient on a long-term basis. So coming to the short term, it can be simple bronchitis, which can be because of any viral infection or bacterial infection, which gives patient trouble with coughing, wheezing, breathing difficulty, fever, with the bad weather, with the bad air quality, they are more prone to get all these problems. Coming to the long term, see somebody who smokes, definitely they are going to get smoking related lung problem, which we commonly referred as bronchitis or chronic obstructive pulmonary disease or COPD, in which they will have breathing difficulty, they will have less stamina, they will be having coughing all the time. uh, Coming to long term, asthma is also a problem which is hereditary, which starts in the early childhood, then it takes sometimes in your young age. It also gives patient difficulties in breathing, coughing. There are certain diseases which now we say as a lifestyle related diseases, like commonly we are seeing tuberculosis. Now tuberculosis we can see in each and every state of our society. It was considered as a disease of a poor, but nowadays we are seeing patients staying in good apartment, traveling in Mercedes and getting tuberculosis. It's purely because of the lifestyle, like bad eating habits, bad sleeping habits, long fasting hours, increased stress level. These are all making them prone for catching up tuberculosis in a country like India, in a city like Mumbai.
Okay, got it. Doctor, how to prevent bronchitis? Can it be prevented?
See, in a city like Mumbai, in a country like India, bronchitis, you can't say it will be prevented or it can be eliminated. To a certain extent, we can have some measures which will reduce that frequency or occurrence. If you are a smoker, then at least we should stop smoking. That will make you vulnerable for all this bronchitis. If you are asthmatic, if you take regular medication, if you follow up with your doctor regularly, it will also prevent you from getting such bronchitis. In a bad weather, if you are like the current season where we have cold, we have bad air quality index, avoiding early morning walks can also prevent development of such bronchitis. In patient with poor lung functions, in elderly, in a patient with existing long-standing lung problem like COPD or interstitial lung disease or asthma, we always recommended to have a flu shot annually, yearly, so that they also get some prevention from the seasonal flu, which is also one of the commonest trigger for development of such bronchitis.
Doctor, is asthma hereditary? Because in my case, my father had asthma, but we are four daughters. None of us is had asthma or are having asthma, but during childhood, I developed bronchitis. And I kept, even at this age, and frequently I used to get cold and cough and fever very often. And then I finally, you treated me, and I'm much better now. I don't get those. So is it hereditary, or anybody can contract it?
See, by our traditional teaching, asthma was considered as a hereditary disease transmitted through genes. And if any of the family members, maybe in the previous generation, had asthma, there are high chances that the next generation may get asthma or allergic manifestations. Medical, it is called as atopic situation. In that situation, you may get frequent sneezing, skin allergies, urticaria, asthma, bronchitis, or acidity. But there is a change in the thought process and the development in asthma understanding. Now we are typing the asthma, something called as genotyping, something called as phenotyping of asthma. So in that we see many patients without any family history, without any strong family history of asthma, they are also getting asthma. So in that situation, sometimes environmental factors may also contribute. In fact, nowadays we are getting many youngsters with asthmatic symptoms. The parents say we don't have any asthma in our family. Our grandparents, nobody had asthma. Then why he is developing asthma? When we go into the history, maybe their eating habits, maybe the way they are staying, they may be exposed to some allergens, and then they can develop asthma. Nowadays, the young people have eating change in their eating habits, like they are having less of fruit consumption, more of Chinese, because there is a contributed factors like Ajinomoto, vinegar, preservative, coloring agent may contribute to development of allergies and asthma. So maybe lifestyle had changed, the eating pattern had changed. So that's the reason we may not get a strong genetic or hereditary contribution for this asthma.
Okay, doctor. Doctor, how does one get allergy? I mean, is he born with certain things that this he's allergic to this or he is allergic to that? And also, is how is allergy connected with asthma?
See, asthma is considered as an allergic phenomenon or allergic condition. So when you ask how we develop allergies, it's a genetic or individual predisposition of getting these problems. To give a simple example, see, there are three people, or we both are here. You have a calm personality. Even if somebody irritates you, you will not get irritated. If say considering me, I may get irritated with small things. So this is a personality difference. So similarly, individual have their own allergy level. When the allergy levels are high, these individuals are prone to get allergic conditions, asthma, skin conditions like urticaria. They may get frequent sneezing, running nose. So it is individual genetic predisposition to get that, which get aggravated when they are exposed to environmental conditions, bad weather, or if they are exposed to allergic chemicals, they may get this problem.
like gases, etc.
See, gastritis is also considered as allergic manifestation because somebody with elevated allergy level, we do get associated acidity or gastritis, what we commonly say. In fact, there are many papers, there are many research papers which have shown strong correlation or strong contribution of acidity to asthma. In fact, if some asthmatics is not improving, we proactively give some medicine to control the acidity, because acidity or the gastric acid reflux and asthma has a strong correlation. They complement each other.
Okay. Doctor, is there no cure for allergy? It can only be controlled, I suppose.
See,
Because
it
I
can
too
be
had, you had recommended me to take an allergy test, and um, so can you throw
see,
some light on that?
See, allergy can be controlled, but sometimes there are certain allergic conditions, like particularly to asthma, we have some condition called as ABPA, allergic bronchopulmonary aspergillosis, in which individual get allergy to some fungus called as Aspergillus fumigatus, which is there in the environment, particularly coastal part. We have this fungus in the environment. Few people do get allergy to that, and they develop asthmatic symptoms, which sometimes need frequent use of steroids. So that condition can be controlled, or to certain extent can be kept under good clinical control with certain medications. In some allergy tests we don't recommend to each and every individual. However, if they don't respond on optimal medication, somebody requiring steroids frequently, then we do go for allergy testing. There are certain centers who are offering for desensitization, like they desensitize your body as per your allergic report, so that you may get certain control over that allergy.
Oh, okay, doctor. Doctor, would you recommend what would be the ideal diet for having lung, a strong respiratory system in your body?
See, there are few studies in children. Like there is one center called as Chess Research Foundation that is based in Pune. They have conducted good studies among the kids, among the school-going kids, and they have concluded if the fruit consumption is more than 4 times in a week, it will it will prevent development of allergic symptoms, asthma. It will control their asthma. So definitely fruits, all kinds of fruits, what we say regional, seasonal. Like whatever region you stay, whatever season, I think that you can have without any problem. There are studies which have recommended or which have concluded that if the junk food consumption is more than 3 times in a week, it will also increase your allergic tendencies, or it will increase your propensity for asthma or bronchitis. Typically, all allergic patients or asthmatic or patients with chronic respiratory problem, we do recommend to be away from Chinese, mainly because of Ajinomoto vinegar. Avoid preservative, avoid any packed food, processed food, anything with a coloring agent, your carbonated drinks like soda, Pepsi, Coke, that can trigger their problem. So I think you should be away from this. Green leafy vegetables, your fruits will always be welcome as far as the lungs are concerned,
Okay, green vegetables and fruits, etc.
and fruits. Yes, yes.
Doctor, what made you do a course in yoga? Is yoga very much related to, and is it a very good thing to do for lung related diseases?
See, I think we can't. There is no doubt. There is no debate like whether yoga is good or bad. It is definitely good. The course, what I did, I was just met somebody who had done that course, and then I searched on Mumbai University website. It is under the Department of Philosophy. you can say there are too many courses under that department, and there is a basic foundation course in yoga. So when we say yoga, people are under impression that different asanas, different postures. But yoga is not only asanas; it is to do with your philosophy also. The yoga itself is a philosophy for life. So in that course, they used to have 3 hours of theory, 3 hours of practical, and in practical they used to teach all the asanas, basic asanas which are required for you for your day-to-day well-being. It is not that you can teach to somebody else, but simple. And they used to tell us which asanas are indicated, contraindicated. A high BP patient can't do XYZ. A patient with a spine problem can't do XYZ. That theory or that practical they used to say, along with Yoga Sutra, along with philosophy. I got introduced to philosophy during that course. Like I I think many of us don't know in detail about Indian philosophy, but they tell you in detail a simplified way to introduce our Shad Darshanas or 6 darshanas what we have. And it's interesting. Like I stopped my practice during those Saturdays, but I used to enjoy. It's a different field, and yoga definitely will help you to keep your mental peace. See, don't see from the philosophical or from the spiritual angle. See, when you work in a stressful condition, see, every day is stressed out. Let it be any field. I think nowadays a school going kid will also, you will hear saying that I'm under stress, I'm stressed out, mujhe tension hai. So everyone, including engineers, doctors, whatever field you are in, they are stressed out. So you need to be having good mental control so that your productivity is good. You should be bodily fit enough to do your, at least to be healthy to perform your day-to-day thing. You should not be falling sick. So yoga can help you in everything. It will help to maintain your mental peace and the physical fitness.
Since mind and body are related, that is why.
Yes, 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 yes.
Doctor, do pranayams help a lot? Generally, people say pranayams help a lot in breathing exercises.
Breathing exercises will definitely help you to boost up your lung capacity. There are certain kriyas like your Kapal Bharti will also help you to clear your mucociliary clearance, which is a filter for all the bacteria and the viruses. Breathing exercises, pranayam, there are certain other kriyas will also help you to boost up your lung capacity. It
Anulom
will
vilom.
be considered anulom vilom. It will be considered as a preventive medicine or preventive way. It will not cure your problem, but definitely it will make you more stronger from the lung point of view.
Okay, doctor. Doctor, other than yoga, do general exercises like going to the gym or dumbbells or anything, these help in
See, it depends upon what is your age, what you want, what are your targets. See, for a college going student, I think he will have his different targets. He will have good physique. He would like to have to show his good physique to others. So for him, the target is different. For a person who is 40 plus, I think 40 to 50 or 55, his targets will be different to have good cardio stamina, to have good muscle tone. And 60, 65 plus, they will have their different, like they should have more endurance, they should be more stable as far as their day-to-day activities are concerned. So going to gym, see, simply whatever is practical, whatever you can do, which can be easy to maintain, that is always welcome. If you have time to go to gym, definitely you can go to gym. But I think simple exercises which you can do at home, it is always the preferred. Simple Surya Namaskar. I think you can do daily Surya Namaskar. It involves 12 asanas. It will have good muscle stretches. It will help for your back. It will help for your lung. If you club with those mantras, 12 mantras, I think nothing like that. It will help to keep your mind clean, and you'll get
very
all
true, doctor.
energy from your sun.
Yeah, very true. Doctor, a person who is having bronchitis or say asthma, can he have non-veg food?
He can have non-veg, but typically we suggest to avoid seafood, shell food, mainly prawns, because that can trigger allergy. Otherwise, non-veg per se is not no to asthmatics. But typically we strongly advise, because we periodically get patients with asthma getting worse after prawns consumption. Like we had patients going on a ventilator after consumption of prawns. So
Okay.
shellfish and the seafood, mainly prawns, we strongly recommend not to have.
Okay. Okay. Best to have sattvic bhojan, I suppose.
In Mumbai, we can't have sattvic bhojan all the day. So you
Simple
can have your
chapati and sabji and dal and salad.
that is always recommended, but sometimes in a city or where the 21st century, I think some days we can cheat. How
Okay.
frequently we are cheating, how frequently we are cheating, that is important.
Yeah. Doctor, what message would you like to give to our viewers? You have given many insights, no doubt about it. You have spoken about every aspect of lung-related problems. But other than that, would you like to give some insights to our viewers?
See, as per, say, I'm a chest physician, so we do get many patients related to lung problem. What I have observed in last 3 4 years time, or mainly 5 years time, post during COVID and after COVID, many youngsters are getting tuberculosis. Many youngsters from good families, good healthy, good rich families, we are getting patients, young people. See, they have their lifestyle. Whenever we see such patients, we first ask them question about their lifestyle: what time they sleep, what time they wake up, what time they take their breakfast, what time they have their lunch and dinner. Invariably, 80% of these young people, starting from 16 years, 22 years, 20 years, 1 year, they sleep late at night. Maybe they are on Netflix, they are on Amazon. They wake up sometimes late. Even if they wake up early, they skip their breakfast. They don't know, they don't have fixed schedule for their lunch, and their dinner is also late. So what I will recommend, I think at least we should eat on time, sleep on time. That will prevent all these infections. We should have some, at least 15 20 minutes, some basic exercise. Maybe you can go for a walk, you can go some pranayam, at least do some surya namaskar, at least 10 minutes of surya namaskar every day. I think it is feasible, it is practical every day. Somebody with asthma, somebody with existing lung problem, they should be regularly visiting their doctors. They should be aware of flu vaccine, pneumococcal vaccine, which will help them to get prevention from all these infections. They should be doing regular breathing exercises. They should be enrolled in something called as pulmonary rehabilitation. In during COVID time, we had many patients who had suffered bad COVID, lungs got destroyed, but with good breathing exercises, something called as pulmonary rehabilitation, they are back to normal now. So there are many things which are beyond medicine. See, as an Indian, we only want medicine. Even if we give one tablet, they are not happy. They need 5 6 tablets. But that is not good. That is not good. I think we need to be thinking beyond medications. We need to be thinking about diet. See, medicine or patient care has to be comprehensive. It should club your medication, it should club some preventive ways, it should club some ways to boost up their immunity, boost up their mental stamina. See, people do get stressed out with simple sneeze also. We get frantic call in the morning, doctor, since morning I'm sneezing. They call as if they got a heart attack. So you can wait for a day, you can wait for 2 days, do some home remedies. I do agree after COVID, the confidence limit and the fear factor is more, but at least you should be rational. You should not be rushing to the hospital, doing X-rays, doing CT scan that frequently. At least give some time for your body to fight back.
Doctor, since you mentioned COVID, I'm curious to know COVID was also related to respiratory problems only, no?
The COVID, the predominant target of that virus was lung only, and the other were associated like cardiac event, the neurological event, but the predominant target was lung. So we
Okay.
used to get patients with respiratory failure. We used to get patients who developed lung fibrosis, destroyed lung after COVID infection, particularly in first wave.
Okay. Thank you very much, doctor. You gave a lot of insights to us. It was a really beautiful insights which you gave. Thank you so much, viewers.
Thank you,
Thank you, 10 News Live team, for helping us. Bye.
thank you, ma'am.